Hello, and welcome to Everyone Dies, the podcast where we talk about serious illness, dying, death, and bereavement. I'm Marianne Matzo, a nurse practitioner, and I use my experience from working as a nurse for 47 years to help answer your questions about what happens at the end of life.
And I'm Charlie Navarrete, an actor in New York City, and here to offer an every-person viewpoint to our podcast. We're both here because we believe that the more you know, the better prepared you are to make difficult decisions. Also, this podcast does not provide medical nor legal advice. Please listen to the complete disclosure at the end of the recording.
Welcome to this week's show. We're so glad to have you join Charlie and me for the next hour as we continue with our series titled Everything You Always Wanted to Know About Cancer, but Didn't Have Anyone to Ask, with a conversation about why the term no evidence of disease, or NED, is used instead of telling someone their cancer is cured. This podcast is a combination of education and entertainment. Edutainment, because we like to make up words, delivered in 3 halves. Our main topic is in the second half. You can fast forward to that babble-free zone if you'd like. In the first half, Charlie has our recipe of the week and a report about being cancer-free. In the second and third halves, Dr. Jeanne Ford and I are talking about the difference between the terms NED, remission, cure, and cancer-free. How you doing, Chaz?
Fine. I have nothing to complain about, but, I still do. We all need a hobby.
Well, and you do it so well.
Well, yes, I do. Thank you. Wait, what?
You're welcome.
How's everything out there?
It's nice. I'm getting ready to go to Michigan for a couple of weeks to see my family, so I'm a bit focused on finding my cold clothes, cold weather clothes, because I'm going to the upper part of Michigan, and it never really warms up there. But it's been since 18, 19 years old since I've been up there.
Wow. It's been, for me, it's been 10 months. But before that, I'd never been up there.
We used to vacation up there.
Yeah,
We'd get
I never
a
had it.
cabin once a week.
Just absolutely spectacular.
Yeah. And I was looking for places to stay, and they would, were advertising cabins. And I'm looking at them and was like, oh my God, those are like the cabins we stayed in, which were, like a room and a bedroom and a bathroom, all in 500 square feet or something.
Speaking about traveling, our first half finds Everyone Dies in Vermont this week, whose name comes from the French phrase Vermont. Yeah, there we are. Something those 3 years of junior high French did not go to waste. Vermont, meaning green mountain.
I thought you had something in your throat.
Yes, it's a frog. Many frogs are green. Therefore, why Vermont? Meaning green mountain and not green frog. And was its own country before becoming a state, Vermont. Vermont is the home of Marianne's first boyfriends, Ben and Jerry. She still can't decide which of the brothers she liked best. And Bernie Sanders. And when it comes to cooking, nothing says Vermont like Vermont chicken pie. The recipe we have for you is 165 years old and will be consumed at your next funeral lunch. The pie, not the recipe. Faster than you can say, I love Bernie. Bon appetit. I have for you today a letter written by Ron Cooper, a cancer survivor who takes a closer look at the trouble with using the phrase cancer-free when discussing cancer with friends and family. Dear friends and family, I need to shoot straight with you on something very important about my prostate cancer. Yes, I am in remission, and yes, I have registered a perfect PSA for 4 years. When you hear that, you may declare me cancer-free. And yes, that's kind of true. but I'm not really free of this beastly disease. I merely wanted to protect you from the stark truth that cancer is often a career criminal and not a one-time offender. For many survivors, such as myself, it is our constant companion. Good for now, but later? In 2014, I was diagnosed with stage 3 prostate cancer. I had surgery that year, and within 6 months, the cancer was back. Radiation and hormone therapies followed and put the cancer in check, well, at least temporarily. At my last PSA reading, the urology nurse said, "Congratulations, Mr. Cooper, your PSA looks good again. There is nothing to worry about right now. See you in 6 months for your next test." I asked her if she could extend my test to every year, but she demurred. "I think we're going to have to watch you closely," she said, adding matter-of-factly, "We'll be seeing you for the rest of your life." I appreciated her honesty, but it sounded like a life sentence without parole. The whole truth and nothing but. PSA readings after surgery are the bellwether for potential recurrence for prostate cancer. When someone like me gets a good reading, we are not exactly free of the cancer. We can claim, however, there is no current evidence of the disease. The problem is, that's a mouthful to say and it begs explanation. And I'm so exhausted by advanced cancer hanging over my head. I'm just not up to the task. No, I'm not a death's door, but I'm not the answer man either. My number one goal is enjoying the spontaneous moment, squeezing a little joy out of this disease, not answering endless Facebook queries. Sorry if that sounds a little mean-spirited. Cancer, nagging and worrisome. At every turn, cancer is persistent, nagging, and worrisome to those of us who fight it. Complications arise, such as weakened immune systems and illnesses associated with that. Some of us end up getting secondary cancers. Chemotherapy can bring painful neuropathy in hands and feet. Cancer is a thorn in our sides. Truly, there's absolutely nothing free about cancer. It's costly not only in a financial sense, but emotionally as well. It's a dark shadow that hangs over our horizon. Treatable is often more accurate. Please don't assume that free means cured. Many cancer survivors cannot make that claim. It's best to say that our cancer is treatable, and further, that treatment can often be never-ending. I know many cancer survivors who choose not to make a big deal of their illness. They are content to get a Facebook post or tweet congratulating them on being cancer-free following a scan or test. There's nothing wrong with that, and there is something very gratifying to be supported during our journey. But please, friends and family, don't assume anything. Let the one living with cancer define or clarify our status in our own good time. Pretty please, don't jump to any conclusions. In it for the long haul. I know this will leave you hanging and uncertain about the full scope of your loved one's health and well-being. But with cancer, there is good reason to use the word journey because that's what it is after all. It's not a jog around the block. You will earn your stripes as a true blue supporter if you sign on for the long haul. You will earn extra points by calming the survivors' anxieties during the COVID pandemic, even though hope and vaccinations are around the corner. You can still bring soup, but be sure to leave it at their doorstep. With cancer, the right words count at the right time. So do friendship, love, and understanding. Thanks for all you do and all that you are doing during this journey fraught full of uncertainty. We're counting on you. Please go to our webpage for this week's recipe for Vermont chicken pie and additional resources for this program. Everyone Dies is offered at no cost, but is not free to produce. Can we count on you to contribute? Your tax-deductible gift will go directly to supporting our nonprofit journalism so that we can remain accessible to everyone. You can also donate at www.everyonedies.org. That's every, the number one, dies.org. Or at our site on Patreon and search for Everyone Dies. Marianne?
Hello, and welcome to our second and third half. In this part, Everyone Dies is pleased to welcome back Dr. Jeanne Ford, who's a clinical nurse specialist from the Department of Internal Medicine at the University of New Mexico Health System in Albuquerque. So our topic today is about the language used by specialists when we talk about curing cancer. Advances in cancer diagnosis, screening, and treatment have greatly improved with the 5-year survival rates of most cancer over the last 30 years. Long-term survivors of cancer are increasingly common, and research is increasingly directed at helping people live well after a diagnosis of cancer. But even so, many oncologists still hesitate to use cure in their language when they're talking with patients. More often, they use words like remission, no evidence of disease, or how we'll talk about that from now on as NED, no evidence of disease. Or they'll use words like cancer-free or most likely cured. But if we're going to be honest, there's always a risk of a future recurrence. Even if the risk is very small, it's still there. Oncologists might use the words remission and NED synonymously. Both words mean that no cancer is currently detectable in the body. That is usually based on scans, blood work, tissue biopsy, or a bone marrow biopsy. So Jeanna, welcome to the show.
Thanks for having me.
Thanks for being here. So how do you explain NED to your patients?
I think that's a really good question. And often, we get people coming in, and there's just so much that goes into this too. As we all know, it really kind of depends too on the cancer, because with some cancer, they have a higher rate of recurrence versus others, with lower rates. And then, as you said, once you get to the 5-year mark, 10-year mark, longer and longer away from it, we feel a little bit more optimistic. But it really, there's so much that goes into it. And so when they ask about that, they don't often ask about no evidence of disease. I often hear people say, well, I want to be cured of this. And if it's not realistic, that is something that we will usually talk about. And I usually, do my wish, worry, hope statements. I really wish that that's something that, we can achieve, but I worry with this type of disease, that, you know how that goes. But I'm hopeful that we will be able to, achieve so many more years, whatever that may be. But when we talk about no evidence of disease, I make sure and tell them, what that means. Very much what you said, that, there's basically that there's no cancer detectable in the body, but it's still one of the biggest things I tell them. It's really important, to keep coming, back and do the, surveillance imaging and the lab work, because I think so often, understandably so, people are just exhausted once they reach that point. They've gone through all of the chemo, radiation, sometimes surgery, for months, sometimes years, and to hear that, and they just kind of want to run away, clicking their heels, and be completely done with medical people. And I get that, but we don't want them to just, drop off the face of the earth, because I can't tell you how many people have achieved no evidence of disease, not done the lab work, the surveillance imaging, and come back 3 years and have metastatic disease. And so it is really important to kind of stay on top of that.
Well, and when we talked about what is metastasis back a few weeks ago, one of the things that we said was that with metastatic disease is that those cells, those cancer cells, can go off wherever they want to go, and they can just sort of hibernate there. And they, at that point, may not be causing any trouble. They're not growing, so we can't see it on the scan. They're not growing so that we can't detect a biomarker. And they're just hanging there. And they could hang there forever, or they could one day sort of get a wild hair and say, oh, I think I want to grow now. And then they will start to grow. And so even though we say no evidence of disease, I mean, that's the most accurate thing we can say. We don't see anything on your skin.
Yeah. Right. Yes. And that's why it's so important to tell them that, but we still have to do the follow-up, and we recognize that, that they're tired at this point, but, that's what I often tell them is please still do your, surveillance imaging, the lab work, and, depending on, again, what type of cancer it is, and how far out they are, that varies. But, it's exactly like you said, there's just no evidence of it right now that we can see. And, we remain hopeful that it will stay that way, but there's always a chance that it can come back.
And so I was thinking about this when we decided to talk about it, and in all my work in oncology, I really can't remember anybody asking, so what does this NED mean? They, they're not saying like, what do the letters stand for? They're not asking, what does this really mean for my future? Have you had patients who've asked you that?
No, I've never had them ask. Quite frankly, I don't really hear them use that term that often. The terms that I feel like my patients are using most often when they bring this up is they'll say, I'm hoping to be cancer-free or to find a cure, be cured from this. Or they recognize I can't be cured from this and all the treatment I'm doing is just to slow the growth. Those are the three things. I've not ever really heard them use the term NED as much. And so, that is something we do talk about. If it does come up, but, to try and kind of explain it. I really do try and explain things as non-medical as I can because this is such an overwhelming time. And, they have so many people that they're having to see and talk at them. And it doesn't matter if you're medical or not. It's very stressful. And, I've been on the other side of that, with family and, it's just going all over my head. I was an ICU nurse for years. And then when my uncle was in the ICU and, not doing well, the intensivist was saying all of these foreign words to me, like, multi-system organ failure and dialysis. And I had to say, I need you to say all of that again. I promise I'm not stupid. I just have no idea what you're saying. And so I can just imagine for somebody else that has never heard this before. So, I think it's really important to, make it as simple as possible.
Well, I'm in all kinds of different cancer-related Facebook groups. And what I'll see is people will post, that's my oncologist, I'm NED, I'm cured. And I restrain from explaining anything. I'll just, thumbs up it or whatever, because there's that element of hope that's really important to people. And then there's this element of, do people really know what the word cure means? Like to you, Jeanna, what does cure mean to you when it comes to cancer?
I would say it's almost like a mythical unicorn. I don't think I've ever heard that being used. And so from a medical side, so if a patient uses it, I really try and say, okay, what does that mean to you? Because when I think of a cure, it means that the disease has gone away totally. There's no more treatment, no more anything needed, and it's never going to come back. That's the key for me, is that it's not going to come back. You're cured. And I don't think we can say that with 100% certainty with any type of cancer. And so, that's where I would, kind of challenge them and say, I really want us to be careful when using this terminology. And so I would want to know what their definition of cure is. We both come from a background in oncology, and I've never heard any oncologists use that term. And so I would be curious as to where they got that. If, the team said, you're in remission or there's no evidence of disease, and they're taking cured and applying it to that, which I can understand, wanting to remain hopeful. But to me, there's a big difference between cured and no evidence of disease. Because again, cured means the disease is gone, no treatment, it's not coming back, whereas no evidence of disease, as we talked about, just means that there's no signs of it on any test and we can't see it, but that doesn't mean it's not hiding somewhere.
And I think that that's the piece that oncologists don't say. They'll say your NED, your scans are all clear. We don't, but I don't think that they go that next step and say, and just because we can't see it doesn't mean it's not there.
Right.
They don't. I mean, I've had cancer and I'm on surveillance, and I'm thinking of all the family meetings I've sat in, of all of the, sitting in with oncologists in their appointments, talking to their patients, and my own personal experience. I've never heard anybody say, and just because we can't see it, it's not there.
Yeah, that's really unsettling. But, I do really think that, we really need to slow down and make sure that they understand, and I don't know what it is. That's a really good point to kind of ponder. I don't know if people get tired of being the bearer of bad news, so they just want to, give some good news and not elaborate. I don't know what that is, and I feel like I've been on the other side with oncologists when they're saying, okay, right now I'm not seeing any disease, you've achieved remission. However, we still need to do this imaging in 6 months, 3 months, what have you, more lab work. But I've not heard them say cure or explain it that way that you're saying as well. I usually do that, and so I'm just kind of used to being a Debbie Downer anyway. So
that's
I'm like wagging my finger going,
practice nurse.
Yeah.
I've had so many physicians say, "Oh, Dr. Matz will explain that to you," and then pick up their stuff and walk out. It's like, thanks. You've had that experience, haven't you?
Oh yeah, very much so. Yeah. They're like, we don't have time to do that. So I'm like, okay, that's why you're doing it.
Right. They just don't want to. So I did some research about what's the definition of cure. And actually I found a few different ones. So one was that it means that patients will have a normal life expectancy not affected by cancer. So I guess what that means is whatever your normal life expectancy is for you, you're going to have it despite the fact that you have cancer. Second one I found, this was from the NCI, National Cancer Institute. Cure means that there are no traces of your cancer after treatment, and the cancer will never come back. That's from the NCI. The American Society of Clinical Oncology defines cure as when a person's cancer has not returned for at least 5 years after treatment. And another definition of cancer cure is when the death rate of people diagnosed with a certain cancer returns to the level expected in the general population of the same sex and age. So I guess it's really, with more words, what the first definition is saying. So with regard to cure, data from the American Cancer Society indicates that survival has steadily improved for almost 30 years for nearly all common cancers. For instance, the overall annual cancer death rate dropped continuously from 1991 to 2017 by 29%. So in the United States, approximately 2.5 million fewer people have died of cancer during the last 30 years than would have died if cure rates had remained unchanged. Even with these data, we know that the reality is late relapse is still possible. So Jeanna, do you use the word cure when you're talking to your patients who are living with cancer?
I don't. No.
You don't?
No, I've never used that, just because with the rate of reoccurrence, and it's again, with some diseases, with some types of cancer, there's a higher rate of recurrence than others. But I usually will say, achieving remission, things in that nature. But I guess for me, cure is almost like the smoke and mirrors thing out there. And I just feel like I don't know how medical that is. To me, it just doesn't feel very medical to me. And being on the other side of that, there's just always a chance of that coming back. I mean, I know that I would say there's more of a chance of recurrence than there is of it not coming back with a lot of these. And so that's why I just hesitate to do that, because, more often people are going to remember, well, you said cure, you promised, you did this. And it's just, I just think that that's so dangerous, and again, I think that, once you get farther out from the diagnosis and the treatment, 5-10 years, I think we're more in the clear of not having recurrence, but that doesn't mean that it will never happen.
Right. And I was going to ask you, it's interesting you just said that. So do you think that the word cure, when anybody's talking to a patient and their families, is interpreted by them as a promise that the cancer isn't coming back?
I do. I do feel like that's what people, that they kind of hang their hat on that. Like when you say cure, it's like, it's done. It's final. I'm finished with this. It's kind of got a finality to it. And so that's why when somebody says cure, I'm always like, tell me what that means to you. What do you mean by that? What does cure mean to you? Because, most of the time, I would say 99% of the time, that's what it means. It's like, I'm done. I'll never have to come back. I never have to do treatment or scans, anything again. I'm done. But, I want to make sure that before I kind of go down this road with them, that we're on the same page. And so that's why I always ask them, well, tell me what cure means to you. When you say that, what does that mean to you? So that way I'm not, assuming anything, but it does kind of have a finality to that. And so I think people are, and I think that's, I would be in the same boat that they are. I'm not judging them in any way. I would want that too. I would be like, no, that's what I'm looking for. But, we also have to have realistic expectations and hope. There's always hope. It just may not be in the term of complete cure. It may be, well, I want to achieve complete remission. I want to be this many years out and not have to come back for daily radiation and chemo or immunotherapy, whatever that may be, or have particular goals. I want to see my, grandchildren graduate high school, whatever that may be. But, I worry when people use the word cure, like, what does that mean to them?
Well, and even
kind of a catch-all.
Right. Well, even from the 4 definitions that I found, that tells me that, American Society of Clinical Oncology or the NCI or whoever these other 2 definitions came from, there's not a standardized term or definition of cure. And one of the things with when you're doing research is that you have to have, here's how I'm defining this. And it helps in healthcare if we all define it the same way. And so clearly that hasn't happened in the cancer world with the word cure. Now you're Native American yourself and work a lot with that population. Do you notice that cure has a different meaning with the Native American patients that you're caring for?
Um, I don't know if it necessarily has a different meaning. I think that they, have the same hope that, if there's a cure, that means that they're done with the medical community, that they don't have to keep coming back. There is such, as we've talked about before, with a lot of different tribes or pueblos, an inherent distrust of, the Western medical system. And so it's really kind of walking a fine line, by getting the treatment, staying informed. But whenever, it comes to a lot of traditional beliefs, a cure or healing process isn't just about eliminating the physical illness, but also kind of restoring balance, spiritually, mentally. And most people that, carry those beliefs, those traditional beliefs, are doing their own prayers and ceremonies, and are guided by their own healers, medicine men, women, the leaders within their tribes or pueblos. And so, cure to them, I think hope looks a little bit different. It's interesting. I have a patient that I was seeing about a week or two ago, and he's, in his late 70s, and, chronic kidney disease, dialysis, and he has a new diagnosis of cancer. And so very poor prognosis. And, he's like, I don't like coming, into the cancer center, and I don't like going in. And he's like, because all these medical people just keep telling me how bad this is going to be. And he's like, they try and take away my hope. And he's like, and he goes, I'm not scared to die. And he's like, I get to see my mom again if I die. He was like, it's been almost 20 years since I've seen her, and I have a lot I want to talk to her about, and so he's like, but I just don't like the way they always try and take away my hope. And he said, so I'm going to go ahead, and he goes, I'm going to do the treatment, for my sister and my brother, my kids. And, and he said, I'm also having, a traditional ceremony. People are praying for me. And he said, I'm not scared either way. And he goes, I just don't know why medical people always try and take away hope. And so I thought that was really kind of profound, and it really is, and there's such a way that we do have to phrase it to where we're not, trying to completely squelch people's hope, and, let them know there's still meaning on either side, hope. And so it is really tough trying to navigate that.
Yeah. And I always think, and I know I always told my students that, our job is never to interfere in somebody's hope. That's theirs. And that what they're going to hope for will likely change over the course of their illness, but there's always something to hope for. And, when patients ask about prognosis or a very direct question, I would always say, well, I can answer that for you, but it might not be something that you really want to hear. Do you want me to tell you the truth? And you have this moment of pause. Always kind of felt very similar, where, they look into your eyes and they decide, do I really want to hear this? And usually, I don't know, I want to say 100% of the time, because if they're asking, they want to know. They'll say, yes, I want to know the truth. Well, okay, then I can tell you that. And I explain it to, whatever the answer is to their question. But my intent in teaching them or giving them information is not to undermine their hope. It's to give them the information that they need to make the decisions that they need to make. And so it's like I listen to you tell me about that guy, and then I think, does our wish to answer questions and give them information to make the best choices that they need to make get interpreted as you're trying to take something from me?
I think sometimes it can. And, I think that what you did was really good and important in practice. And that's something, we've always getting, the habit of, and we tell our fellows and our students is, always ask people, whether it's outpatient or inpatient, how they like to receive information, and I just tell them, some people, when they're, facing an illness, want to know absolutely everything there is to know about it, the good, the bad, the ugly. Other people don't want to know. They only want to remain on the positive, even if that means that some information is withheld. They would rather us tell their kids, their sister, whoever, where do you fall into this? And if they say, well, I don't want to know, and I'll say, just to clarify, even if this means we may know about, disease progression or, the time left, you don't want to know. And they'll say yes. And so then that way, I think that that's important to know, because especially with some traditional people, it really is, and elderly people, it's considered offensive to just continually to tell them that whenever they don't. It's almost like bringing that about whenever you verbalize that. There's that belief. And so it's better to tell somebody, to talk to their children about that. And so, I think it really is important to ask, the whole ask, tell, ask, and just make sure we're okay before going down that path. And I think, and it's going to be different. And I think we've all been taught so much patient autonomy, they have to know, but that is patient autonomy. If they're telling us, right, I don't want to know, I want you to right. tell my children, that is their right.
Right. And I think you're right that we get kind of lost in, but you have to know, you have to make the decisions. It's like, no, they don't.
Mm-hmm. Yeah,
they don't.
Exactly.
But, we have to stop and ask the question. And then, like, for our listeners, kind of your job is then to say, what is it you want? We'll respect it. But we have to know, like how much do you want to know and when do you want to know it, if ever?
Exactly.
Now, in talking about cancer recurrence, I found a study by Lisi and colleagues. It was a Australian study that documented that the most frequently reported unmet needs of Australian cancer survivors are for help with psychosocial issues, including the number one issue was a fear of recurrence. And that was, in their study, between 14 and 42%. And the second top issue was uncertainty about the future, and that was 12 to 26%. So this indicates to me that we need to make an effort to help people living with cancer, that our care is acknowledged, and that we both, I guess, have to accept uncertainty while also calming anxiety about a cancer recurrence. Mm-hmm. So how successful do you think we are in doing this?
I think that it really, I hate to say this, but I also think it depends on where you are. I think some places are better, with cancer survivorship than others. I think that for me personally, and I don't like to put this on others, knowledge is power. So I want to know everything there is to know, that way I can be prepared, but not everybody is like that, and so that's why, I tell them, it really is important that we do, the surveillance imaging, we do the lab work. That way we can stay on top of this, because if there is any type of recurrence, we can, get in there early. But I think that also frightens some people. And so I've heard from many people, any type of ache or pain I get, I'm worried it's the cancer coming back. Mm-hmm. I don't even want to make plans about the future, because what happens if the cancer comes back, and so we do spend a lot of time talking about that, going ahead and, living your best life now. You feel good. You're finally out of this, do that. I think the bigger cancer centers and that have more funding do a really good job of survivorship. And, I think there, as we both know, there's people that, have dedicated their entire career to cancer survivorship, have support groups for that, do counseling for this, because it is a very, very real, can be very frightening and cause anxiety, even once you're past that, like to navigate, because nobody knows what they've been through, what they feel like, how, and their body is never the same again. And there's just so much that goes into that. And so I think that it is really important to kind of, find other people that can understand that. But, I think in more rural communities or underfunded communities, it's just, there may not be as much resources. And so, I do worry about that, the isolation in that.
That's true. I'm wondering, I haven't checked into this lately, but do they do like online support groups, that kind of thing?
They do. I feel like that kind of peaked during COVID and up through 2022. And then some of it has gone back into person, and then some of it, just kind of, dwindled away. I do have a lot of patients who don't like online support groups. They want to meet in person. And then I have others who are scared to meet in person. So it's really tough. It's kind of split 50-50 people. Some people want to be in person and others want to be online. And then I even have people who are like, well, I have breast cancer. I don't want to go talk to somebody that has, pancreatic cancer. They don't know what I'm feeling like, so they want specific to them. And so, unfortunately here, there's just not that many resources to have them siloed out in that aspect. And so, the bigger facilities like, MD Anderson, what have you, I think they have those specialized. But I do think that, it is really important to have the tools and the counseling available for the survivorship, because it's a lifelong process. And there is such a thing as medical trauma when you go through all of that. You go through radiation oncology, medical oncology, sometimes surgery, genetic counseling. I mean, there's just so much that goes into that.
That's true. I know at Stevenson Cancer Center, we were fortunate to have specialized support groups, and I facilitated the ovarian cancer support group for, many years, a long time. So you really get to know the women, they get to know you. And ours was a group of women who like to have Christmas parties and like to get together for dinner with the spouses and like to make Christmas ornaments. So they were very involved with each other. And it was, just a great group to work with and be involved with and to, care about. And I get what you're saying, where it's really hard to be in a group, ovarian cancer, it's its kind of own thing, and breast cancer is kind of its own thing, and prostate cancer is its own thing, because what you're dealing with are so different. And
exactly.
And it's hard to be sitting there listening to somebody say XYZ, and you're saying, but I'm only concerned about ABC, and, what am I getting out of this? Why am I here?
Right.
So, hearing a cancer diagnosis is frightening, and it increases anxiety. And hearing the word cure from an oncologist may initially make people feel better, but the anxiety may eventually come back. And I don't know that everybody thinks about it, but we become cancer survivors the minute we receive a cancer diagnosis. And we want to be talked to in ways that are clear, easy to understand, and reassuring. It's also important for all cancer survivors to have a cancer surveillance program. And Jeanna mentioned this over and over in this interview today. So some cancers are considered very low risk, so that you've already done 5 or 10 years without a recurrence, it's pretty doubtful that you'll ever have one. But it's still not impossible, which is why we need to follow up and make sure that the cancer, if it ever comes back, that we catch it as soon as possible. Routine screenings can often uncover recurrence, so don't skip recommended tests, follow up appointments, and imaging. Jeanna, do you have any last words for our listeners?
No, I think that, all of this is very, very important and helpful. And, again, as you said, all of this can be very scary, but it doesn't mean that people can't live a normal, happy life and go out and do the things that they want to do, go on vacations, cruises, go to the casino, all of that, and that there are resources out there. We just, may need help in finding that. So I appreciate you having me on.
Well, thank you so much. I always love when you come and bring us your experience and your insight. And we look forward to talking to you again soon.
Yeah, that would be great.
Thank you.
Please stay tuned for the continuing saga of Everyone Dies, and thank you for listening. This is Charlie Navarrete, and from essayist, memoirist, and journalist, among other skills, Joan Didion, we tell ourselves stories in order to live.
And I'm Marianne Matzo, and we'll see you next week. Remember, every day is a gift.
This podcast does not provide medical advice. All discussion on this podcast, such as treatments, dosages, outcomes, charts, patient profiles, advice, messages, and any other discussion are for informational purposes only and are not a substitute for professional medical advice or treatment. Always seek the advice of your primary care practitioner or other qualified health providers with any questions that you may have regarding your health. Never disregard professional medical advice or delay in seeking it because of something you have heard from this podcast. If you think you may have a medical emergency, call your doctor or 911 immediately. Everyone Dies does not recommend or endorse any specific tests, practitioners, products, procedures, opinions, or other information that may be mentioned in this podcast. Reliance on any information provided in this podcast by persons appearing on this podcast at the invitation of Everyone Dies or by other members is solely at your own risk.